If you're dealing with depression or seasonal affective disorder, Aplenzin 522 mg tablet, an extended-release antidepressant, may be the solution you're looking for. This medication can help improve your mood and overall sense of well-being by restoring the balance of certain natural substances in your brain, such as dopamine and norepinephrine. It's a great option for those who struggle with these conditions and are looking for relief. Just be sure to follow your doctor's recommended dosage and take it at the optimal time for best results. Before you start taking Aplenzin 522 mg, make sure to read the medication guide provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take Aplenzin 522 mg by mouth with or without food, usually once daily in the morning. If you experience stomach upset, you may take this medication with or after a meal or snack. It's important to take it at the same time each day to get the most benefit from it. Taking it late in the day may cause trouble sleeping, so it's best to take it in the morning. Remember to swallow the tablets whole, without crushing or chewing them. This will help prevent releasing all of the drug at once, which can increase the risk of side effects. The dosage of Aplenzin 522 mg is based on your medical condition, liver function, and response to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important not to increase your dose or use this drug more often or for longer than prescribed, as it won't improve your condition any faster and will increase the risk of side effects. Consult your doctor before stopping this medication, as your dose may need to be gradually decreased. It may take 4 weeks or longer before you get the full benefit of Aplenzin 522 mg, so be sure to inform your doctor if your condition does not improve or worsens. Some common side effects of Aplenzin 522 mg tablet may include dry mouth, sore throat, dizziness, nausea, vomiting, headache, decreased appetite, weight loss, constipation, trouble sleeping, increased sweating, or shaking. If any of these effects persist or worsen, it's important to inform your doctor. You may notice an empty tablet shell in your stool, but this is harmless as your body has already absorbed the medication. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. It's important to monitor your blood pressure regularly while taking this medication, and to notify your doctor if the results are high. Be sure to seek medical attention if you experience fast, irregular heartbeat, mental/mood changes, unusual weight loss or gain, seizures, eye pain or swelling, vision changes, or signs of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects not listed here. Bupropion hydrobromide, HBr, is a medication that is often used to help people quit smoking, as well as to treat depression and other mental or mood disorders. It is important to note that while antidepressants like bupropion can provide many benefits, there is a possibility that some individuals, especially those younger than 25, may experience new or worsening symptoms of depression, as well as other mental or mood changes, including thoughts of self-harm. It is crucial to speak with your doctor about the potential risks and benefits of taking antidepressant medication, even if it is not being used to treat a mental or mood condition. If you notice any new or worsening symptoms of depression or other mental health conditions, or if you experience any unusual changes in behavior, it is important to inform your doctor right away. This includes any thoughts of self-harm as well as changes in mood, such as increased anxiety, panic attacks, difficulty sleeping, irritability, or impulsive actions. It is especially important to be vigilant for these symptoms when starting a new antidepressant or when the dosage is adjusted. If you are using bupropion to help you quit smoking and you experience any of these symptoms, it is important to stop taking the medication and contact your doctor immediately. Additionally, if you notice any of these symptoms after stopping treatment with bupropion, it is important to inform your doctor right away. Before taking Aplenzin 522 mg, it's important to talk to your doctor or pharmacist about any allergies you may have and any inactive ingredients that could cause allergic reactions. You should also discuss your medical history, especially if you have diabetes, heart disease, high blood pressure, kidney problems, liver disease, or a history of seizures. It's important to avoid suddenly stopping the use of sedatives, drugs used to treat seizures, or alcohol, as this may increase the risk of seizures. This medication can make you dizzy, so it's important to avoid alcohol and marijuana, and to use caution when driving or using machinery. Older adults may be more sensitive to the side effects of this drug, particularly dizziness and memory loss. If you are pregnant or planning on becoming pregnant, it's important to discuss the benefits and risks of using this medication with your doctor. This medication can also pass into breast milk, so be sure to consult with your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Aplenzin 522 mg tablet. These interactions can affect how your medications work and may increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Aplenzin 522 mg tablet include codeine, pimozide, tamoxifen, and thioridazine. It's crucial to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, and selegiline, with Aplenzin 522 mg tablet, as it may cause a serious and possibly fatal drug interaction. Your doctor will advise you on when to start or stop taking this medication in relation to MAO inhibitors. Additionally, this medication may interfere with certain medical or lab tests, potentially causing false test results. It's important to inform lab personnel and all your doctors that you are taking Aplenzin 522 mg tablet. As with any medication, it's important to follow your doctor's instructions and take Aplenzin 522 mg tablet as prescribed for optimal benefit. If someone has taken too much Aplenzin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures, severe confusion, hallucinations, rapid heart rate, and loss of consciousness. It's crucial to act quickly in these situations to ensure the individual receives the necessary medical attention. It's important to remember not to share this medication with others. Your doctor may also want to monitor your blood pressure and liver function with lab or medical tests while you are taking Aplenzin 522 mg tablet. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Aplenzin 522 mg tablet, just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. It's important to store Aplenzin 522 mg tablet at room temperature, away from light and moisture. Be sure to keep it out of reach of children and pets. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.